Appreciate it. There's been a lot of stuff going on, man. I've been away. Hasn't been really known. Quick missing thing of, you can come on. Yeah. We will now call this meeting to order. First, we'll read a notice. Board of Alders will give a notice. The Health and Human Services Committee will meet in person on Thursday, July 27, 2023 at 6 p.m. in the Board of Alders Chambers, 165 Church Street, second floor, New Haven, CT, to deliberate and act on LF-0053. Order concerning the communication title from Tom Goldenberg submitting a request for a public hearing on the future of safety sites to discuss what is being considered and what is being done. This item is on file and available for public discussion in the office of Services, 65 Church Street, New Haven. Per order on Alex Guzman, Chair, attests on City Town Clerk. If needed accessibility related accommodation, 203-946-7651 voice or 203-946-858. In accordance with the city meeting, COVID-19 policies, the masks are now optional and public may send CT.gov. Before we begin the meeting, I'll just have my colleagues quickly introduce themselves, starting from
Amy Marks.
Another word for
Chair Bishop Pro, Ward 27, visiting the committee.
Alex Guzman, Ward 1, Chair.
Eli Saban, Ward 7.
yeah, Troy Street in Ward 21.
My colleagues have introduced themselves. We will now hear from the maker of this item. So if the maker could please come up. And just a reminder, name and record before beginning to speak.
My name is Tom Holder. Address is 324 Nickel Street. So I have some documents I'd like to teach you. I don't know if you can mind this pass these. The packet of information has a letter that I submitted to the Board of Alders 2 days ago, and then supplementary documents from the city that were received subject to the Freedom of Information Act that I'll be referring to in my testimony. So let me just start off, since this is the first hearing where you have others, so let's just start with what are we talking about here. So a safe use site or a safe injection site can also be called an overdose protection center. These are designated areas in the municipality where anyone is free to go and bring substances such as heroin or crack cocaine and use those substances in a facility, free of any type of penalty of law. So I just want to set the record straight. This is not the same thing as a methadone treatment center. While safe injection sites might be located adjacent to treatment centers, it's not considered a medical treatment. Now, what are the proposed benefits of these sites? Why would the municipality be considering them? The proposed benefits are that if someone is injecting heroin and they undergo an extreme event that could lead to an overdose fatality, then being under supervision allows a person to intervene, apply Narcan or whatever intervention is required, and then save a life. So that's what's driven the expansion of the program. The actual implementation in the U.S. is quite limited, but I'm sure we'll hear other testimony from other people that will share more on that. How did I hear about safe use sites? And when did I start to get involved in this issue? I would say it really started early on in my campaign. A friend of mine shared, so as you know, I'm a candidate for mayor of New Haven running as a Democrat, and I announced my candidacy at the end of December. And around January, someone shared with me an article from the New York Times, which I'm happy to share with you all. And it was a long-form piece that really described what actually is happening with one of these sites in Harlem. So the first site that was done in New York City was done in Harlem. It's been operating for years. And the piece discussed the pros and the cons. One of the cons was that community felt that because it was a underserved community, did not have access to advocate for itself, that it was chosen to be there rather than in the location where the need was. Because people, the opioid epidemic is not a urban issue specifically, you find it throughout. So they found that the majority of people that were suffering from opioid addiction were not in Harlem, but the treatment or the facility rather located in Harlem. That's just some of the pros and the cons. And what does that have to do with me, right? At first, I didn't see any connections to New Haven, but I had numerous complaints about methadone clinics in New Haven. And I spent 1 week visiting every methadone clinic in the city, pretty much. I spent a lot of time on Congress Avenue by the App Foundation location there. There's been a lot of quality of life incidents. I interviewed numerous dozens of people, including drug dealers on the site in Congress Avenue. They themselves told me that it was not an appropriate location. I spoke to patients, both the Congress Ave location and other locations, such as the Front Ave location in West Haven. I spoke to clinicians. So I spoke to a wide range of individuals, and through these interviews, I was told that the city of New Haven was considering safe injection site. And I heard this through numerous sources. So that brought my not just my curiosity, but my concern. Because if the city was considering it, why had there been no public record of this at all? And so my next immediate step was to open up a Freedom of Information request. I opened 2 requests. One was on the App Foundation and methadone clinics in New Haven. That request has still been unanswered and submitted in March. So several months later, it's been unanswered. I submitted a Freedom of Information complaint about it. There's a hearing on August 16th in Hartford, so I'm still waiting for those documents. But I also submitted a second Freedom of Information request on safe use sites. That was in April. Now, after I submitted those requests, I decided to get some first-hand experience. I did not want to speak about this issue without having done my homework. So me and several of my campaign staff went to Harlem, 125th Street, and visited in an unannounced manner the OnPoint NYC facility. And in part of this documentation, I have some interviews and testimony from individuals that I interviewed at that site and around that site. Now, normally, if the city administration were to visit a site such as OnPoint, it would be a planned meeting. But because we were unannounced, we spoke to several individuals there. We spoke to when we first arrived there, there was a gathering of maybe 20, 25 people outside, loitering, hopefully, some of the users there, and then also activists were there as well. We had a conversation with them. They themselves, one of them said that they did not think it would be a good idea for downtown or for a city. When inside, what we observed was about 30 to 40 individuals, in various states of condition. A lot of noises and a lot of people in distress. And then there would be a room where people would go to inject the heroin. So that's what we observed inside the facility. I also saw that right across from the facility was a daycare. Here we have actually someone in this room gave testimony that I believe quote that OnPoint NYC a very positive relationship with the daycare, but that's not what my interviews with the daycare leadership and individuals that work at the daycare have shown. There have been several quality of life incidents. The director of that daycare, who I was able to contact, had a lengthy conversation about some of the incidents they had, but in terms of a public testimony that she would be willing to provide, I shared what I have at the end of this document, where she says that any consideration by a municipality to establish a safe injection site should be done at the beginning with community input. So I thought that was a strong statement. And I walked down the street, we saw that there were people selling drugs who belonged to a housing complex. I tried to approach them and ask them their thoughts, but they were unwilling to speak to me. So I left their presence. And then I went further down and I spoke to some of the local businesses. And what you see, if you could turn with me to page 16, I have the transcript from one of these local business owners. This is a Black small business owner of a salon that had purchased a 5-year lease. I'm just going to read some of the testimony.
Before you continue, I just want to make sure a lot of people in the room here tonight. I'm not cutting you off. Just want to make sure we're making conversation. Folks who are here to testify. We did receive all these materials, just so you know, to everyone's email, including your letter, and a lot of the videos, exhibits, et cetera, et cetera. I just wanted to let you know that, just so I'm not repeating maybe already. I'm sure before.
Well, I think I have to tell the story of what is led up to these documents, and I'd like to review what the documents are for the public.
but just let you know that we received the documents, just so, in case. To take the time. So, I mean,
I'll try not to repeat myself, and I'll try to go as fast as I can.
appreciate it.
But this is important, the transcript owner. I can summarize, you can look at the video yourself because they were not willing to be visually photographed, but they did record their audio. They regret signing the 5-year lease. They've had violent interactions. They have to physically lock the door at all times of business, and it's caused a massive decline of business. So that's the gist. Everyone here should have access to that testimony. Now, finally, and remember, I'm a mayoral candidate, so I have used my position to pressure this administration to release these documents on several campaign forums and debates. I mentioned that I was waiting for the documents, which I said I haven't received, not all of them still. But last Friday, I did receive these documents. And the gist of them is that I think that this was done secretively. I don't think that it was done in an appropriate way. I think there are financial questions that are unanswered that I would like to raise to this board. And I think that Dr. Bilal and the administration circumvented the authority of the Board of Alders, which is why I have asked for an investigation into those practices. Now, let me just explain what documents, because these are documents provided by the city. The first document that was provided to me is on page 3. It is a message from someone at Vital Strategies Consulting Group to Dr. Bilal. It provides some notes from what seems to be a meeting to discuss overdose prevention centers or safe use sites. And if we go to the next page, page 4, we can see the attendee list. I would like to call out that Lynn Madden, who is the director of the App Foundation, was one of the persons in attendance. And then on the next page, I want to call out something. On page 5, when it says the options, it gives 3 options. It says Yale, city-run, and nonprofit, and then it says Shields. I have to assume that Shields meaning Shields from a liability perspective, because it would be illegal under federal law, as well from a political perspective. If I take you to the next document, remember that is in January of 2021, more than 2 years ago. And just to be clear, the mayor has never mentioned the word overdose prevention centers or safe use sites until I called it attention and wrote about it in an op-ed in the Register about 3 months ago. The next document is from on page 6, from Dr. Bilal to Pat King, who is the corporate counsel. You can see that a consultant, Vital Strategies, did work on the topic of how to circumvent city ordinances to establish a safe use site. That does not seem to me to be exploratory in nature. I do not know how much money was allocated in Vital Strategies. There are many other emails and work that Vital Strategies did on this topic that I have not released. This is just one example. You can see, for example, the drug paraphernalia zoning provision, where anything that allows the use of drugs or whatever, it says it's not permitting in any zoning district. So there's a discussion on how they can get around that ordinance, as well as other ordinances such as drug traffic, loitering, and anti-blight. So that is a big question that I have. How much money did the city pay from our taxpayer money for Vital Strategies? And what was all the work? What's the contract? How is that allocated? That's a question that I have. The next document, like I said, I'll go quickly through these, is on the next page, on page 8. This is a email from Mayor Justin Elliker to Dr. Bilal, Administrator of Community Services Administration. Justin Elliker says, looks good, thank you, in response to a plan laid out by Dr. Bilal. I would like to call out that many of the steps in this plan have been accomplished already. Whether it's identifying an organization, identifying prospective sites, identifying prospective funders, obviously legal and statutory barriers we saw on the previous page has been discussed. I could go on and on. It is concerning that there's no mention of community input in all of the first 6 months, and it barely gets a mention in the planning stage, and it seems to me that it's more of an afterthought than anything. So I do not think that this is exploratory at this stage. Again, this is September. This is almost a year ago. Again, before the city had announced any intention to do anything with overdose prevention centers. I will mention, we will talk about the identified organization. I see Mr. Steve Werland is here. Very clear from these documents that downtown EB2 was the identified lead overdose prevention center organization. That's very clear in these documents. And they also receive funding to, for other services as well. So there's things in there that are related to whether it's zoning pathways or things like that, site design. I'm not going to get deep into that. On the next file, you'll see page 9. This is a message from Vital Strategies, the consultant to Dr. Galal. Here you can see that it specifies desk, definitely sufficient. It says that the concept note outlines the work we hope to do with desk, but it's fair to say at this point that desk is the identified overdose prevention center partner. It says it's still waiting on final approval, and that there's a proposed budget. So at page 12, you can see this laid out plan as well as the budget. I think for this part, there's a concern for me here because if you look at the very bottom, this budget, $200,000. Now, I received word from our Director of Legislative Services, Al Lucas, that any appropriation, either more than $100,000 or multi-year in nature, has to be approved by the Board of Alders. I'm not aware of any process that went through the governing body of the Board of Alders, and that's I will return to that question. But I would ask this board, is that an appropriate use of funds? And that's why I think that there should be an investigation. I'll turn to the next page. This is page 13. Here again, we mentioned about Steve Werland. This is from March 8th of this year. I just spoke to Steve about next steps regarding funding. So funding is being discussed. Again, I'm not aware of any discussion with the Board of Alders on that. I turn to the next page, 14. This is an interesting turn of events. This is from Steve Werland to Vital Strategies. Here it talks about Greg Gonzalez. He appeared in the first email, but this is part of Yale's health initiative. He's more than willing to help by, quote, serving as the intermediary. So it's not clear what that means. I think that this should be subject to the investigation. What role did Yale play and why? I get to the next page. Again, this continues from Steve Werland on page 15.
I hate to interrupt you.
I'm almost done. I have 2 pages
I
left.
just want to make sure that
I'm very close to being there. This is very important. This is again on March 24th from Steve Werland to Vital Strategies. It says that it's going to have Greg from Yale to be the point of contact, quote, to avoid linking this directly to desk. So we go back to the first document. It says that the city wants to shield itself to a non-partner, and the non-partner wants to shield itself with Yale. That is the end of my documents. I leave with this. I think that this has been highly concerning. I still have not received the documents I requested related to App Foundation. I asked, what does the city have to hide? Especially when these documents I requested much later than I requested the App Foundation documents. I hope that this is not our last public hearing on this topic. I have talked to downtown business owners. I have talked to law enforcement individuals. They are all, the majority, opposed to this initiative, especially it being downtown. And why do I say downtown? Because if desk is the nonprofit partner, we do know that Desk owns downtown property. It's the only property that it owns. And so therefore, I think it's a safe assumption the mayor does not deny that that location. So this is good for the city. It's certainly not downtown. This would be in the state. I do not believe that New Haven should serve as an experiment. And so I'm calling for transparency. I would like an investigation into why the administration circumvented the Board of Alders when it comes to this $200,000 appropriation. And I would like this to be continued as a discussion. Thank you very much.
Thank you for your presentation, Mr. Woodward. Now I'll ask if any colleagues have any questions for the presenter. Seeing none, thank you for your presentation.
Thank you.
We will now take. Sorry. Before we take public testimony, we'll quickly have somebody from the city administration come up and present. So I believe Dr. Dalal. Not anymore. Okay. So is anyone else from the city going to present on this? No one. We will now take public testimony. Just to make a quick announcement, we'll kindly ask folks to keep their testimony to 3 minutes, and please keep it as germane as possible to this item, which is about future safety protection sites, and about what's being considered and what's being done. So, to begin, we have.
Point of order, Mr. Chair. Has moved on from this city and would no longer represent the city in this matter. But I'm just wondering if there's anyone from city staff that is present that would testify on behalf of the testimony that Mr. Goldenberg gave. Thank you, Mr. Chair.
Thank you. So to move forward, the first name we have on our list is Libby Kayla Johnson. Name and address for the record.
My name is Libby Macula Johnson. I reside at 1237 Clinton Avenue, apartment 2 here in New Haven.
You may continue.
Thank you. I'm here tonight because I've been a New Haven resident for 18 years and I appreciate the opportunity to speak with you this evening. 3 years, 10 months, and 2 days ago, I found my older daughter dead after she injected a fatal mix of heroin and illicit fentanyl. She was 22 years old, beautiful, brilliant, empathetic, hilarious, and just one of 1,202 overdose fatalities in Connecticut in 2018. She had struggled with substance use disorder for over 5 years. Supervised consumption sites or services, harm reduction centers, and syringe services programs save lives. In addition to providing opportunities they also provide outreach, education, and health promotion services. SCSs are designed to reduce the risk of HIV, Hep C virus transmission, prevent overdose fatalities, and connect people who use drugs with addiction treatment and social services. Harm reduction understands drugs as a complex, multifaceted issue. I think many people think that people with substance use disorder can simply choose to stop using drugs, if only it were that simple. According to the FDA, stopping opioid use abruptly or reducing dose too quickly can result in serious problems, including withdrawal symptoms, uncontrolled pain, and thoughts of suicide. Even when opioid use is decreased gradually, people may experience symptoms of withdrawal. The relationship between mental illness and substance use is a particularly complicated one. According to a 2021 study conducted by the Substance Use and Mental Health Services Administration, around 9.2 million people in the U.S. struggle with both substance use and mental illness. When an individual experiences both of these at the same time, they're referred to as having co-occurring disorders. My was bipolar and bipolar disorder. When misuse opioids flood the brain with dopamine, the process creates intense feelings of euphoria and also encourages the brain to repeat the behavior, which can lead to addiction. For people addicted to opioids, these drugs are often providing them with something that they're not getting out of daily life. People who struggle with opioid use say that these drugs created feelings of warmth, happiness, and acceptance. They describe feeling good in a way they've never experienced before. These feelings can motivate someone to continue use even when that is putting them health at risk or causing problems in their life. Maya once said to me, "Mom, no one wants to be unhealthy." And I truly believe this in my heart. Please have compassion and sympathy for those struggling with substance disorders or SCSs and harm reduction to prevent more overdose.
So much for your testimony. Thank you for being here.
So another order. Thank you, Mr. Chair. This is a very sensitive matter, so I want to say this as sensitively as I can, but and we appreciate the testimony. I heard my cousin just a few months ago from an overdose, and it's horrific. But before us today is not a overdose or an injection center. This board has no knowledge of any injection center coming to the city of New Haven. We appreciate, Mr. Chair, the testimony of Mr. Goldenberg, and we are certainly going to look further into this to see what's going on, because anything that is, if this was to happen, it would have to come through this board for approval, as far as I understand. And so, Mr. Chair, if you're going to hear testimony on the approval or disapproval of an injection site, that is not the topic that is for this committee. And it's a very difficult thing, because you don't want to turn people away who've come to testify either for or against, but that's not what we're talking about. We're talking about the future of a safe site and to discuss what is being considered and what is being done. To our knowledge, nothing is being considered. Nothing is being done. Nothing has been presented to the Board of Alders. And that is the proper process. If the administration has not done that, then that's something that we need to discuss. But I'm not sure how you would like to continue. You're the chair, but I was kind of setting that I would hate for people's anticipation or expectations to feel that they're speaking about something that we haven't even received yet.
Thank you, Majority Leader, for your point. I think what I'll ask moving forward is for the folks, as the Majority Leader just said, there is no specific plan being discussed at this meeting. And so if folks want to alter their testimony or maybe say a couple words about, or just more broadly, generally speaking, about the item, what the future safe use. People want to alter their testimony based off of that, and they can do so. I do agree with you, Majority Leader. There is, I think that was the point that should be made a little bit earlier. I'm glad that you made that point. There's no specific plan being considered at this moment, so there isn't a specific site or specific plan that you have undertaken that folks can intensify for. Having said that, I think we will continue, but I would again ask folks to please stay germane to what we just established. Next, we have Emma Magliato. Name address for the record, please.
Emmy Magliotta, like 65 Dwight Street. Rapidly trying to change what I've written, and I appreciate you taking the time to hear everyone out this evening. I just wanted to express my overwhelming support for overdose prevention sites that's specific to the issue at hand. I appreciate the meaningful strategizing and discussion of how this potential could be made our reality in New Haven. And I appreciate seeing the documents, and I appreciate seeing the potential pathways forward, specifically in downtown. I really look forward to seeing the future pillars of how we can bring more hard support to New Haven. I look forward to having see this come to we can more information about how we can do this, the partners we can bring in, the efforts we can hear, bring this to our city. I really don't have too much to say, honestly, related to the testimony that was shown. I don't think it speaks for itself, honestly. To see that there are people who are deeply invested and dedicated to the city, who want to see this process. And to see overdose prevention sites and overdose consumption sites as our city. So I appreciate seeing people working towards this and for our future development.
Thank you so much. Next up, we have J1 Carter. Name and address for the record, please.
J1 Carter. Wait. I'll start by saying this. I know what it felt like when one of my parents missed my graduation from high school, and the reason. I know what it's like throughout my entire life with that story. Just today, I got a call from an officer in a different town looking for a particular parent because his drug addiction influences petty thefts. So I know what that's like. I know what it's like for me as a child of this such moment to do some of this healing work, to not do it myself and not let the pressure dictate some of my actions on how to react to these moments. Dealt down, I had to put that work to not be business. But I also know what it's like to have a technical overdose, lose his life. And I know what it's like where an officer on the scene says, "Do you know that?" And I said, "Yes." And I asked him to call because the next day is and the officer said, "I'm not going to make that call. I'm going to make the call." Pay for the call. And make that call. And I was like, when I still hear that particular cry from time to time. Now, on this work assignment, it was very emotional. It took a while to process certain things. And when we arrived there, you've seen advocates who are getting signatures to protect harm reduction, right? And then you learn about the memorandum of understanding in which this is a site that's protected where folks could get the help that they're looking for. I don't know all the science into this work. I just know it's like being a child of someone with drug addiction. However, I want to know more. I want to learn more. That time being there, politics is involved. You see the distribution of street drugs, and you hear the signals when the cops are around. You hear the 5-0, you hear the you. So the folks know to walk away, to get away from trouble. And then you see the street level, and then you see those who need help trying to get into the building. But then when the patrol leaves, it goes back to what was just happening. Although the street is a challenge facility. Because it's politics involved, there was a offer of conversation. Because no one wants to lose their job when they're trying to provide for their family. When we don't agree with part of that conversation, offer was pretty much revealing how there was a drastic drop in enrollment. The business suffered. And they just wish that if anybody, or an entity, municipality, could just have enough public input to figure out what is the proper structure, infrastructure, and just they work without it having an folks always try to advocate as well for community. I have to say that moving forward, consider the infrastructure and what it looks like, because we are all in this together. Just want to make sure that when we are having these discussions, we put in the proper resources that could potentially be needed to support neighboring citizens, whether it's business owners, homeowners, whatever it may be. But at the end of the day, we have to do something for our people. We have to figure out stuff that's not being produced here. We got to also attack that point. As I come to a close, I'm just here to just figure this out. I just hope that we continue to have community input around this. Thank you.
Thank you for your testimony. Next up, we have Joseph Green.
Good evening, everybody. Second Clark Street, New Haven, East Rock neighborhood. All right, my glasses on. Let me start by saying I am in favor of safe use sites. I am in favor of putting my neighborhood. Not so much in favor I am of. Drug use, I want to go off, is an illness. It's not a choice. Supervised safe use sites are the right step towards detox and treatment. In Europe, Switzerland and Germany worked on a successful model in which safe use facilities were used to offer addicts a connection to the services, treatment, and enforcement. These two countries reported massive success in offering referrals to detox facilities. 45% of addicts in Germany, 43% of addicts in Switzerland achieved total recovery and abstinence following the implementation of this program. Clients feel safer. Studies have shown people in recovery using safe use centers felt physically and psychologically safe as opposed to those using in the street. Using drugs in the streets comes with a myriad of challenges. Many women reported encountering incidences of sexual harassment. Others experienced physical violence arising from disputes, and many complained of being forced to share drugs and pills. People are advocating for the establishment of safe usage sites to help curb the current fentanyl epidemic. Using a facility ensures that the nature and quality of the drugs are safe. As an aside, only 5% of overdoses are heroin. Most of them are fentanyl based. The current epidemic is not showing any signs of easing up. We need to act before more of our sons, daughters, husbands, wives, mothers, and fathers are found dead. It's a loving environment where people can safely and use safely to stay alive. That's the executive director of a nonprofit that runs safe use sites in New York City. We're showing up for people who too many people view as disposable. For a lot of people, just providing a safe space is an introduction to services. Safe use sites reduce crime in the area. Don't find drug paraphernalia in the streets, and you don't have an influx of dealers hanging around the area. Safe use sites are not killing centers. They are not going to hurt, kill users, or mentally ill clients if you follow the facts and not the vast amount of misinformation. The truth is quite the opposite. These sites are saving lives. Misinformation feeds into the stigma and fear associated with the ill-informed. The stigma of drug use plays a major role in preventing users from help. My son was addicted to opioids, and his drug of choice was oxycontin. Clean for 7 months, and a moment of weakness led to the purchase of 3 pills. He thought they were oxycontin, but the one he took was straight fentanyl. He was dead before he hit the floor in the bedroom. Fentanyl poisoning is very real, and it's the #1 danger to users. I bring this up because Cameron was home. Cameron was in his bedroom, his safe place. Safe use sites are just that to many people, safe. When my son died, many friends and even family would not acknowledge what happened. It was a mark of shame to them. They wanted nothing to do with us, and still don't. Safe use sites will go far to aid users in coming out of the shadows, receiving the services they need, and giving them back their dignity, so they don't experience what I. Thank you.
Thank you so much for your testimony, for being here. If you so want to, you can leave your written testimony with staff just to begin with.
No problem. No problem.
I see that Dr. DeLaw's signed up for public testimony. As we can reiterate again, Dr. DeLaw does not work for the city anymore. Just so people know that as well. David, I just
in this street. Haven't forgotten so quickly the procedure here, so nice to see everyone again. As I was considering whether to revise or modify my testimony according to what the business is here, I think I'm going to decide to just go with it as I've written it. I will touch upon some of the data and I think speaks to why considering for New Haven. I'll also speak to clearing up some of the misconceptions that I knew about before walking in, but there's some additional misconceptions that are raised that I will need to walk. I'll try to clear up those that I can, but those that I can't, I'm happy to have a separate conversation with one of the members. I speak today to offer my perspective as a former community services administrator for New Haven and a New Haven resident. I currently work for the state of Connecticut Department of Social Services. I will note for the committee that I'm not representing my current employer, and my comments do not necessarily reflect their views. The city has been hit hard with the opioid overdose epidemic. The proportion of this tragedy are difficult to appreciate. In 2015, there were 26 deaths due to overdose in New Haven. By 2021 and 2022, 118 and 130 deaths respectively, far surpassing the death toll for COVID-19 in those years. We're seeing a larger share of our illicit drug supply containing fentanyl, fentanyl analogs, xylazine, stimulants such as crack and cocaine are adulterated fentanyl, and users are not aware that they're ingesting opioids. Every week, 2 or 3 residents of our city lose their life to a suspected overdose. This is by any definition an ongoing and unfolding public health crisis. We call to do. Overdose prevention centers are places where people can bring drugs they've obtained elsewhere and use them under supervision of trained personnel. Trained staff attend to overdoses immediately, saving lives. Clients are also connected with important services and social supports, including substance use treatment, mental health services, case management, and other basic needs such as food and housing. The former speaker, Bree, I think, described it really eloquently around this. It is a safe space for folks who are struggling. New York City opened the first official overdose prevention center in the U.S. in November of 2021. Since then, it has hosted over 50,000 visits and intervened in over 700 overdoses without a single fatality. Globally, there are over 100 sites in operation, and again, no reports of fatalities in these sites. They can reduce public drug use, fringe litter, and emergency calls without increasing drug-related public crime. A recent economic evaluation found that for every dollar spent on an overdose prevention center, $8 could be saved due to reduction in ambulance rides, reduction in emergency visits, and hospitalizations. Diverse organizations such as the American Medical Association, American Civil Liberties Union, and the Cato Institute, which is a right-wing institute, have written in support of overdose prevention centers, The concept is not a panacea, but it can save lives and is strongly worth considering in the context of unabated public health crisis here in New England. I'd also like to correct some of the recent mischaracterizations about the city's approach. There is no allocated budget, as this committee knows, because nothing has come before the board. So there is an allocated budget. What you've seen in the documents is discussion about what a budget might look like, and that budget is only for planning purposes, not for actually the operations of the site. In fact, the idea of supervised consumption sites was listed in the mayor's transition plan in 2019, so nothing secret about this. And city officials, including myself, have been openly discussing this idea for some time, including in community meetings, Board of Health meetings, where there was a report that endorsed the idea of supervised consumption, presented to the board and discussed in a public meeting, and during harm reduction coalition meetings, which are open meetings. I myself testified before the Connecticut State Legislature in March in favor of the idea. Characterized as a secret is not correct. And often it was community members and organizations concerned about the harms of drug use and understanding the limitation of law enforcement type approaches. They would ask us whether an overdose prevention center desk was on several organizations the city discussed the concept with, and their current role and interest is outlined in their own testimony. Additionally, stakeholder and community engagement has been contemplated as one of those vital steps of planning and feasibility. I think the committee knows that under my leadership, my record was very focused on community engagement, whether it was the Compass program or violence prevention program. We were very community forward, but we needed a plan to bring the community, not just concepts.
Dr. Sorry, before you continue, I just ask maybe another minute.
Sure, I'll be finishing in a minute. All the benefits of this make sense. In fact, the same outline that I sent to the mayor that was cited by the first speaker say that there was no idea of community input. In fact, it delineates that the idea that community input is I think more concerning than some of these characterizations is the notion that we can sequester harm reduction services and treatment services in unpopulated, undesirable parts of the city. If you're struggling with addiction, the message of this approach is we don't want it. It's a message that perpetuates stigma, one of the main barriers to seeking help. A healthier, more constructive message, in my opinion, would be: we see you, we understand you, welcome you, and are willing to meet you where you are and help you in the ways that make sense. An overdose prevention center could be a part of that approach. I thank the committee for consideration of my testimony.
Thank you so much. Have any questions? Majority Leader?
Mr.
What's that?
You know what I was going to say.
Sure.
So I think and appreciate your testimony. And Senator Murphy has been pushing for several years for our state to recognize drug addiction as a chronic disease. And I am 100% behind it. It has been stigmatized in our family, and I think we don't talk transparently about it enough. I think that if we would have had these discussions as family, some of my categories would still be alive. I think that it's probably safe to say that a strategic plan would not be the same as perhaps the administration considering. When I hear considering, is why I was a little taken back by this testimony and the money that was involved, and things that were paid that seemingly has not perhaps passed through. I don't know. I'm going to look and see if the grant or whatever's come through, because there is that stipulation. But I don't see an issue with the administration strategizing and putting something together to present to the board members. In our language, Mr. Chair, we would say that we're not considering it because it hasn't come to us. And so it has to come to us in order for the city to consider, because we will have. So what you do as community involvement is not the same as what we would do as public hearing, because this is where the votes take place. And so I would like to that was a statement kind of question to see if you would agree with that.
Yeah, no, I would agree with that. And there is, I can clarify issues here. There was a question about how much did the city pay for Vital Strategies? The answer is zero. Vital Strategies is a non-profit organization that has its own funding and has selected certain partners throughout the nation to work on harm reduction efforts. So, in the city, we did have a memorandum of agreement with them when they when they have details of the work in the city. There has been no money allocated to from city general funds towards even the feasibility study actually fund. And if there were, of course, it would become.
And we would have started the budget. Okay. That's all I have, Mr. Chair. Thank you, Dr. Lau. Good to see you.
Good to see you too.
Thank you, Charlie. Any other questions? Any comments? Seeing none, thank you for your testimony. Next on our list, we have Nikita Brown.
Good evening. My name is Nikita Brown. I live at 128 G30 Avenue, New Haven, Connecticut. I guess nothing was presented to you, and nobody really. My concern would be that if something is presented, that you make sure that the community, all of the community is aware and can give input, as well as like, I just have questions in regards to, because I'm not necessarily, I don't know if I'm for or against, because my dad suffered with drug addiction, and I do, think all life is precious. I just have concerns of like who's able, how do they track who's coming there, the ages, like anybody can come. So I would just have concerns and questions and things like that I would want to know before, having something especially essential to their happen by schools and other things, and before it comes to place, So that's all I ask is that when something is presented to you all, that you make sure all community voices can be heard. Whether it be, we need to go on the radio or something, because, I don't know where what community he was searching from, but I didn't hear anything about this or, anything. So, I think in Haven is hush hush a lot of times, and everyone's input is not valued, and that needs to change. So, the schools make sure that the whole place will be and, we get answers as far as the age requirements and all that, other than people and services, other than that, are they able to just be there all day? Having the questions that I would want to know, what, they will be doing to assist them and try to get them all rehabilitation and treatment, and not just, being able just to sit there and, shoot up all day. But basically, that's how I, understand it as, these programs. So that's why I asked.
Thank you for your testimony. Next on our list, we have Eric Mastriani. My name is Eric Mastriani, 1552 City Street. I want to start off by saying this. For everyone in this room who experienced loss, my heartfelt condolences to your families, because I myself had family members go that way. Now, being from Fairhaven, I am 51, and I've seen since the late 70s, 80s, 90s, up to today, a big problem with opioids. I mentioned my cousin because he went to the methadone clinics. He received stuff from the methadone clinics, but the only problem is that he would go elsewhere to sell it. Or what we were trying to help him get off of. So I would say this, if, and it's a big if this is a consideration of these safe places,
Instead of that, I think we need to look more at these facilities, like the methadone clinics, and get tougher on them, how they administer, how they interact with the people who come there, not just give it to them and let them walk away. It starts with conversation. I myself could tell you, I'm former military. I saved a few lives just by asking questions, as I saw the head down and eyes piercing the ground. You don't know who's going through what their story is. You know, you might save a life. I actually saved the life of a girl who wanted to hang herself, just from a simple conversation. So conversations, but we need to look at these places to do a more stringent job to help these people get off this stuff, instead of just giving it to them and letting them go on their merry way and say they'll be fine. Mental health is a big factor. Family situation, big factor. Economy, big factors. They all factor in. But I think a lot more places like this, to me, and forgive me, I don't think it would help. I think we need to get tougher on the existing places that are in place right now. And as board, you guys should get more involved with these places. Ask more questions, look into more things. You sit behind this desk, you're here to help the community. Great job, you guys do. But to do furthermore, to get tougher on these things and pay more attention to what's going on in our neighborhoods. Thank you.
Thank you for your testimony. Next up on our list, we got Fiona T. Sorry.
No worries.
Fiona Finley, 47 Park Street, New Haven. I want to speak specifically to why we must bring attention and responsibility to the need to urgently strengthen our city's response to the fentanyl and opioid epidemic. I am the president for Cameron Inc., a not-for-profit organization which aims to bring focus on the fentanyl crisis by increasing awareness, supporting education in schools and universities, supporting harm reduction efforts, driving bipartisan legislative change, and bringing attention to the prevalent stigma. Fort Cameron was founded when, after losing my son Cameron to an unintentional fentanyl poisoning in our home 5 years ago, we realized there was zero public awareness of the danger of fentanyl poisoning deaths in our city. Cameron bought what he thought was a 3 OxyContin dose. The pill he took was unadulterated fentanyl. His toxicology showed 11,000 micrograms of fentanyl in his body. That's enough fentanyl to kill 20 people. Cameron was very engaged in his recovery effort since becoming addicted at age 14 when he started OxyContin for a football game. Before he lost his life, he had returned to college and was a student here at Gateway in New Haven, studying to be a recovery counselor as he felt his life experience could help him help others experience an addiction. But one bad day, he saw OxyContin. He called his therapist and left a voicemail for her to call him the next morning. He said, "I'm about to relapse. I just want to sleep, but we can address this tomorrow." I can say without hesitation, had there been an option, he would have availed himself of a safe place to test the pills he bought and be observed by staff to make sure he would be all right. And who knows, being in an unjudgmental professional place, perhaps he would have chosen not to take that pill that evening, and he would have been connected to support resources. Stigma is viewing drug use as a moral failing or a poor choice, but we know better now. Science tells us substance use disorder is a chronically relapsing brain disease, often rooted in trauma or inherited through genetics. Stigma tells us people with substance use disorder don't deserve the same options and respect to treat their disease as supported people with other medical conditions. When one of our community experienced cancer, we don't collectively point a finger at choices they've made or may not have made. The focus is on keeping them alive with evidence-based treatment and with unquestioning support. All people deserve private places to manage their diseases with dignity. New Haven County's overdose and unintentional poisoning rates are horrifying and are far from limited to the use of injecting cocaine. Cocaine use has become very casual among your professionals and increasingly is covered with illicit fentanyl. We need to urgently try something new to move New Haven to the forefront of this public health emergency. In closing, I miss Cameron so much, but I can't think of a more important way to honor him than by advocating for something which will reduce the loss of lives, increase awareness, increase compassion, and help some begin to navigate recovery here in New Haven. Thank you.
Thank you so much for your testimony. Just want to say, give our condolences and thank you for the work that you, everyone at your organization do on this issue. Oh, and you can also leave your testimony if you'd like. We have Carlos, your face.
So Carlos Reese, R-E-I-S. I just want to thank you for giving me the opportunity to express my concerns. So first of all, I'd just like to start. Previously, you stated that this was a public hearing, and my question is, where was this public hearing posted so more people could have been attended? So on the next note is, 7 years ago, I used to work for Moss, which is located on the street, which is a medical facility. And now, how safe are these facilities, and is it safe? And why I bring that up is, I worked there as security, and several times myself and my former co-worker at the time, we've been threatened. We've been threatened. I approached one of the clients, and he stood up like he was ready to do something, and there was another client behind him, and he stood up for the other client, and I had to back up. So are these facilities safe? And also, I reported to my supervisor, nothing. My colleague, or my co-worker, at the time, he was threatened with a knife. He reported to the supervisor. We didn't hear nothing back. All we heard was negative feedback from the administration at this place. On my next bullet point is, I've been living on Kimberly for approximately 40 years and change. And I'm one of the co-organizers for Kimberly Park. And we try to get this, clean up the park. And we started making 20 flowers, 20 trees, and stuff like that. And we try to change the park. And my goal for the park is bring back the sporting events like it used to be like 20 years ago. But it's very, very hard to bring that back because there's a lot of drug people doing drugs and homeless. A couple of years ago, I actually had to call the fire department twice because right behind my garage, they were creating fires under the tree right behind my garage. So the city never did nothing about this.
Sorry, you reached agreement, so just ask you comments maybe to 30 minutes to go.
Okay, so like, again, and one time when I was up there, I found like whole bunch of, at least 20, 30 needles. And nobody wants to go to the park because all these people reside there. They do all the drugs. They have a queen mattress there on the park. And there was like prostitutes and they're doing drugs over there. And how can, I'm a small community trying to get volunteer to change that park. Nobody wants to volunteer and help because, everybody's afraid of going there. And I'm hoping that the city can reach out to us and help us out and clean that park. And so going to the next topic.
You're at 4 minutes now, just so you know. You have a couple people left.
Yeah, I know other people haven't had a much longer time.
I'll ask if you could just keep your items remain to
Alright.
safe use injection sites. Reading about that.
Yeah, okay, yeah, so, I think I pretty much, talked about what I wanted, and also who's gonna do something about, people parking on the sidewalks. I mean, that looks horrible. I mean, people,
We appreciate you bringing that up, but we're not talking about parking.
right, but this is a concern, I mean.
And we appreciate it, and I imagine the colleague in that board has likely observed that and likely communicate and speak with that colleague. Just so you know, we can make this more effective, getting your concern about parking to the person.
So I hope the city can do something about the park and then, because and then even this safe injection, I don't think it's going to help. And I mean, the best solution is the methadone facility, but then again, how effective will it be to helping these people? Because I don't think the safe injection is going to help them out. Because you're going to go to one place and you do the drugs, but you're still going to go somewhere else and live and dump. And then who's going to do the dumping? I don't. Not anybody else. I'm the one who's going to clean the park at the park.
We reached 6 minutes, so just kindly ask.
Okay, I hope you say that to other people too.
Thank you.
Thank you. Yeah, Mr. Chair, if he perhaps will leave his name and address that, and we'll have Ms. Alder reach out to him to address his concerns. Yeah. Address and telephone number.
Next on our list, we have Francesca Baglio. Sorry about that.
Hi, good evening. My name is Francesca Maviglia. I'm a New Haven resident living at 173 North Street in Ward 24. So one of my assets was prevention centers and evidence-based public health intervention. I'm here tonight to comment on certain claims that were made about the process that were discussed in the first testimony by Mr. Goldenberg. And the statements made tonight, as well as statements made to the press and previous communication to this board. So for context, recently I worked with the Global Health Justice Partnership, which is the program I did tonight, as they interviewed me that disseminated a request for proposals for a consultant to carry out a one-year-long study to explore the possibility of establishing an overdose prevention center in New Haven. So as such, I'm familiar with the details of this request for proposal, and I want to highlight several ways in which, in my opinion, the presentation that we heard tonight of facts is misleading. So in the first place, I want to clarify that GHAP disseminated this RFP on behalf of community-based organizations that were interested in exploring the implementation of OPCs. So just want to say very clearly for the record, we were not commissioned by any school official or anyone at the City of New Haven to disseminate this proposal. We disseminated it because we're a public health program. We've been working on harm reduction policy and research for several years. And so we use our networks and our connections to harm reductionists nationwide to find suitable responses for the RFP. It seems that the crux of Mr. Goldenberg's concerns and grievances that we have tonight is revolves around the lack of public communications and community input on the hypothetical implementation of the OPC as well as the cycling for it in particular. So the text of the RFP does include a stakeholder engagement phase, which in fact constitutes a whole third of the entire study. As the name suggests, the stakeholder engagement is precisely aimed at engaging with the community and soliciting input. So I quote from the text of the RFP: the consultant will initiate and implement a community consultation process with people vulnerable to overdose, harm reduction service recipients, business owners, which we heard the concerns about the effect of disorders, elected officials, and other relevant stakeholders. And the findings from the community research process will inform our design, architectural, and citing considerations and public safety strategies. So I quote this to show that it's a particularly important component of what this one-year-long exploratory study will do. I will add that the desk went through an extensive community engagement process before opening their current location in State Street. So I think their factual track record in New Haven does show their commitment to this. Additionally, I saw some additional documents tonight. I think they also point to the commitment and investment in community engagement. We see this on page 8 under the steps that were so the sketch that's necessary for considering an OPC in the future, as well as even on page 4 and some of the discussion, the failure of the Philadelphia OPC project to engage with community was pointed to as one of the key obstacles. So I think that the documents that were provided tonight do not support the narrative that there is no community input built into this exploratory process. And in my opinion, this is a narrative and a claim that we're not seeing evidence for. So thank you for your attention.
Thank you for your testimony, and if you so want to, you can also email your testimony and hand it over to staff. Next on our list, we have Steve Worland.
Steve Worland, 24. I do have a prepared statement that I was going to read that I also emailed to you all. But I'm also happy to address, I think, the first testimony, any questions that might have come up in relation to that. Anyway, as a harm reduction, person-centered grassroots organization with 37 years of community support, engagement, and trust behind us, DESK promotes evidence-based public health approaches to the problems facing people experiencing homelessness and the public. This includes those who suffer from opioid use disorder. To help us better understand and respond to the opioid epidemic that's plaguing those we serve, DESK began investigating potential services program. For that reason, the board authorized me to explore whether or not an overdose prevention center, sometimes called a supervised consumption site, might be right for our organization, our clients, and our city. To that end, DESK has independently accessed private funding to contract with a consulting firm to study over the next 12 months whether or not this is an appropriate public health response to engagement, what the financial and legal risks and implications would be, and whether or not this is right for DESK. And then, and only then, we begin discussions with the community regarding the application of such a program. A critical component of this study involves extensive community conversations with various stakeholders, including people who use drugs, community residents, community businesses, elected officials, law enforcement, and others. These forums are scheduled to be made in the fall as indicated. And it constitutes a full third of the RFP and contract. Community conversations around complex, potentially controversial public health issues should be carried out with care, with respect, and with nuance. The contracted consulting firm has broad experience in gathering community input through deliberative and equitable processes. We have learned over the decades at DESK that doing the right thing is rarely characterized by quick. We at DESK fear that a politically timed hearing on the subject will prematurely force a process that lacks the requisite nuance and result in stifling creative solutions, while dividing our residents into intractable political camps based on campaign sacrifice, and worst of all, it would further stigmatize and demonize those who are most vulnerable and most in need. Therefore, DESK urges the City of New Haven and the Board of Aldermen to wait until after the November elections to hold any further dedicated public hearings on overdose prevention centers. Doing so would provide the time to develop a careful and deliberative process, as well as avoid the over politicization of a topic that should be considered really beyond the shadow of campaign motives. And we look forward to having productive conversations with community members as this work proceeds in a responsible deliberate manner.
Testimony. Any questions? Say no.
Nope. And you know, I expect you to follow questions.
Thank you for your testimony. Next on the list, we have Phil Costello.
live in New Haven. I do work in the streets as a provider of medical care for the people.
Could you just provide an address for the record?
226 Dixwell. I'm not here today to talk about the politics of it, but I am here today to kind of give a framework based on what I know from the people in the street that are struggling. These sites have been compared to clinics, but they're in that methadone clinic. You have to go there in order to get treatment. So there's a steady stream that is coming, whether it be from the neighborhood or somebody else's neighborhood or somebody else's town. These sites, they also have a substance that is needed for those people to try to stay right and to stay on the drugs. The difference with this is these people that are coming into the safe use centers, they can buy a bag of fentanyl for $5. Okay, so they're not going to come from Fairhaven and spend $2 on a bus to come to the center. So these sites have to be in every in order for that neighborhood to have a safe place. Because if you put this in there, people in Fairhaven aren't going to get that. There's no money and drugs in that. That's just a place where they can go inside. Now, when you have a place like this, what you're doing is people, you're not making them, they're already addicted to drugs. They're already on the street. What you're doing is you're taking them out of the door fronts. You're taking them away from the schools and you're putting them into a site where they can be monitored, but they're also not in the middle of the community. So from the perspective that I can see is that we talk about saving lives. These sites also help communities in a lot of ways in terms of taking the people out of those doors, taking the people out of the places in the parks where people are over there getting high, and they put them into these places where they can be safe and have a safe space and not be in a place where other people are trying to walk their kids or other things like that. Beyond that, I don't have much to say. Thank you very much.
Thank you for your testimony. I see all the learning has.
I just want to say thank you, Dr. Phil, for everything you do on the streets of my neighborhood. We you saved a lot of lives, and we really appreciate
Thank you for your testimony again. Next on our list, we have Sue Lagarde.
Dr. Suzanne Bernard, 75 Farm Road in Hamden is where I live, but I work here. And I'm here briefly, maybe not directly for the topic at hand, but I'm here because I want to be the voice for our patients because they really don't have a voice. Drug dependency is a public health crisis that I would argue makes COVID look like a walk through the park. COVID had solutions. Right now, we don't have many solutions for what is really a mini disaster. Fairhaven, where our patients live and where we run 2 large health clinics, drug dependency and associated overdoses are in crisis, are at crisis proportions. Our neighborhood home is home to roughly 5,300 residences, yet in 2022, 32 deaths occurred from overdoses just in Fairhaven. So think about that statistic. 5,200 homes, 32 deaths, and that doesn't even begin to address those who nearly died. From my office on Grand Avenue, I get wheels taking place across the street with striking regularity. Our facilities team is picking up dirty needles from our parking lot on a regular basis, and sometimes particularly in the morning or early mornings or early evenings, we'll have people actually shooting up on our properties. I know the topic for this evening is the issue of reduction centers. That's a conversation that we need to have, but I want to get back to the fact that I want to be the voice. I have to be the voice for our patients because they don't have one. They're not here tonight. We desperately need solutions, and those are likely to come in many different forms. Overseas are not going to be the be all and end all, but they are potentially a part of what is a really large solution. Drug dependency is an illness. Make no mistake about that. No different to heart disease, to cancer. I don't think anybody here would turn their eyes from somebody dying with a cancer or congestive heart failure. Drug dependency is no difference, but it's absolutely one of the hardest diseases to treat. We need the collective wisdom of a lot of people, and we need to put our efforts, our wholehearted efforts into solving these problems because it is taking the lives of our next generation. It's predominantly young people, it's people with the hope of themselves that are being shot down at a crucial time in life. We can't turn our backs on them. Thank you. I appreciate your time. I know you guys spent a lot of time here to addressing a lot of problems. Truly appreciate your efforts.
Thank you for your testimony, and thank you for the work of the clinic as well. Next on our list, we have Paul Garlinghouse.
Good evening, and my name is Paul Garlinghouse. I live in 746. So thank you for really taking a leading role in trying to start a really robust public discussion. I think, honestly, this started out as an effort by some person or persons to score some cheap political points on the backs of people who were suffering and dying. And it's disgusting. And that's what made me mad enough to come out because nobody likes to all this time. But people are dying. People are dying here. They're kids. And let me just tell you, these drug sellers, they're rude, okay? And by the way, such as the legal drug sellers, it's the thrice damned Sackler family who are Connecticut, philanthropists who are the ones who played a key role, among other many green corporations, in getting people hooked on OxyContin and opiates with deceptive and absolutely immoral practices. If you're gonna want to score some political points, why don't you go after them, okay? That's what you want. But also there are the just frightening international, very creative, illegal drug profiteers. They're the ones who have been manufacturing this cheap fentanyl. And this is part of, the whole harm reduction idea, and why I think it's absolutely urgent for you as the lawmakers of our city to be considering safe injection, harm reduction, all kinds of them, to try to save people's lives. Because people don't know, these kids didn't know that they were taking fentanyl. They had no idea. It's everywhere. And as bad as fentanyl and as fatal as fentanyl, it's getting worse. I just found out that there have been increasingly cutting fentanyl with horse tranquilizer, which is actually legal for horses. And when they cut that into the fentanyl, it creates this thing they call tranq. And not only can it kill you, it can create these kinds of blocking wounds that, left untreated, can lead to amputations. So you've seen the statistics. Tom Goldenberg's paper about the email where there's the thousands of deaths and the thousands of non-fatal complications. This is urgent. These are people and they're dying, and these types of centers don't make people hooked on drugs. It's just giving them a chance. They choose to do it in a way where they're much less likely to die and get into trouble. Get into trouble. There's somebody there with expertise to save their lives. Thank you very much. I appreciate you all.
Thank you for your testimony. Next on our list, we have Kenneth Morford. Kenneth Morford.
Good
evening. Address,
Kenneth Morford, 20 Elm Street. So I didn't say anything from that. I really just went from the heart. I'm a primary care doctor and addiction medicine specialist. I treat hundreds of patients with substance use disorder. And I do that because it is some of the most rewarding work I've ever done. I love it. I love my patients because I get to see a lot of them get better. They get better when they're receiving evidence-based treatment. And, we don't hear a lot about that because what's there to say about someone who's living their lives and healthy and doing fine? We hear a lot about tragedy. And I think part of why we hear about tragedy is because, less than 10% of people with a substance use disorder. So like 90% of people who are struggling with any type of substance use are not getting help. They're not, able to reach me for, maybe they're not ready, maybe they don't have the means of getting to a place where they can get that help. And I think that's really where harm reduction plays such a huge role in why I support it and why I practice it. These are strategies and interventions that recognize that, like any chronic condition, we can't change something overnight. Right? It's not like someone walks into the clinic and then we cure their diabetes, walk to the clinic and then we cure their substance use disorder. But as we create these relationships and provide ongoing evidence-based treatment, it is really what makes the difference. And these are the services that we need to have available in places where people are, because they are a way to engage people to come get the treatment and the services that they need. So I just wanted to share my perspective with you here, of course, if I am comfortable, and that I'm doing this work. Don't talk about harm reduction, we're not talking about a free for all where people use substances whatever they want. We're talking about providing a locksome to teach people how to reverse overdoses. We're talking about providing fentanyl test strips so people can see what's actually in their drug supply. As we just heard, there's silencing contamination. I treat those that people come in with. And sometimes that's why they come to me, because they were so afraid to be mistreated by the healthcare system that they didn't want to come get care. They would be treated poorly. But then when they have these huge wounds, they finally said, I need to go see somebody who can help me with this. and not be taken out of this country. So I think if we can provide more opportunities for people to receive this treatment, pay for services that will help them, then maybe we can start to move the needle on something that's been a crisis, a drug overdose crisis for over 20 years. I mean, what's going on? And it started in the late 90s, and it hasn't gotten better, it's only gotten worse. So I think all of these ideas to help people are really what should be focused upon and supported.
Thank you for your testimony and the work that you do in the community. All right, is there anyone else from the public wishing to testify at this moment?
Camille Ainsley, 150 Townsend Terrace. I'm going to give the he says that it's only been 20 years. It's been close to 60 years. Addiction is a disease, and hearing some of the testimony could sway me to kind of see the light in different aspects. But I guess there's two things that I don't hear. One, addiction is a life goal. And so if you're an alcoholic, they don't treat alcoholism with applying a bar and saying, come have a drink, and let you drink until you pass out, that will bring you back to life. That's not how they treat alcoholism. And so I'm only saying that having this harm has a good perspective of it, but I have seen HIV patients that treated them. I've had them die in my arms. They have had huge drug ramifications from that. And so when we think about this as a whole, we can't treat this for 70 years. An addiction could potentially last a lifetime of somebody's life. And it ravishes the family, the community, the school system. It's a longer picture. So the site is a great conception. And you know what? I say thank you for trying something new. This at least we're trying. But I think the conversation has to look at the long haul of how long can it be sustainable to do. And they fund it at a private level for 70 years and really follow this through. And what's the harm when they start this in 5 years and they have to close, and then what? I'm not saying don't do this. I'm saying don't do it in the pavement.
Just to reiterate, we're not considering a specific.
No, I'm just saying, I'm just putting those things out as the thought process. You know, I think people want people to live. I think we need to think today, tomorrow, and the future. Thank you.
Thank you for your testimony, for being here. Is there anyone else from the public wishing to testify? Good evening.
Good evening. Lisa, my phone, 21 Drive, of course. I came here and I didn't plan on providing testimony. But as we've heard, many families have a loss, including my own. We've all been touched by somebody we know, or a family member, a relative. This is a serious, serious problem. We've established something has to be done. I believe sites are a good idea for all of the reasons that were expressed earlier. My concern is New Haven right now doesn't have a good reputation of being transparent with what's happening, how things happen, and I don't see all of the programs or new things that come up with a long-term plan. If we want to do something, work on it, let's do it like this. But what's going to happen 5 years from now, 10 years from now? If the city is not going to partner or collaborate with a nonprofit to do this work, hold the nonprofit accountable. Let's see how we can support them to make it work. Let's be strategic with a long-term plan, not something that let's do it here, let's do it now, and get it done. Yes, it will take time. Yes, there's a lot down the line to take into consideration, but I think each one of you will put a lot of time, a lot of effort into your job, and we appreciate all that work. But we have to go beyond let's just have a conversation. There's gonna be a lot of conversations. I believe Dr. Vaughn said that it could take a year just to plan, just to come up with something. Again, that is what it's gonna take. It is very important. The location, who's behind it. Desk is a very good profit. They do a lot of work. That is positive, great work. We do have great resources in the city, but I think they're underutilized, and again, the long-term plan is the most important. My son's a medic, and when he's in New Haven, 90% of his job is picking the bags off the street. It would be nice for them to be able to have a place not be on the street. We won't see all of what we see on the streets if they have a place to go. So when considering the yes to no, let's consider the long-term plan, not just, okay, this sounds cool, let's do it. So that's what I really want is that there's transparency and then it's what we consider. So thank you.
Thank you for your testimony. Is there anyone else from the public wishing to testify?
No way. John Carlson, 291 Greenwich Avenue, New Haven. So I think everyone has testified and overlooked your earlier point, and I just want to pluses and minuses. We've all lost people to the center, but I want to get back to Justin Elliger hasn't been transparent. And we need to look into his administration and make sure transparent. As a resident of the Hill, the city has forced things in my neighborhood time after time without input. Then they ram it through, then they tell us it's too late. So what I want from you guys and from my mayor is transparency and honesty and public discussion. Thank you.
Thank you for your testimony. Is there anyone else from the public wishing to testify on this item? For the second time, is there anyone else from the public wishing to testify on this item? Third and final time, is there anyone else from the public wishing to testify on this item? Seeing no one, do I hear a motion?
I move that we close the public portion of this.
Motion has been moved and seconded. Any discussion? Seeing none, all in favor, say aye. Any opposed? Any abstentions? Public portion hearing has been passed. I'm seeing that this is the workshop. Sorry, this is a public hearing. I believe the only course of action is to read and file. So do I hear a motion to read and file?
File the item.
Motion to read and file has been moved and seconded. Any discussion?
Thank you, Mr. Chair. As we said at the beginning, this is a very sensitive subject. And the title of this communication. And so I am in agreement to that first to this item with the hope that when the administration submits something for us to consider, then we will hear that item with through a public hearing, with due public participation and input. But since there isn't anything before us this evening to consider from the administration, then it makes sense to read and file this item with the hopes that in the future there will be a correct title to come before the appropriate committee to hear. Mr. Chair.
Thank you, Majority Leader. Any other comments from colleagues?
Thank you, Mr. Chair. I just want to say that I also support reading and filing this item. I also just hope that we can continue having conversations about this issue. I think I definitely know, I personally feel like I have a lot to learn about, what, and I think we all do as, as this is a crisis that we don't have a ton of answers for right now. I think it's something that our right now is just hard to really comprehend. I just hope we can have a conversation and keep all these happen as much as possible. And try to figure out solutions that will help our residents to make sure that folks are safe. Thank you.
Thank you, Alder. Any other comments from colleagues?
Thank you, Mr. Chair. I just want to thank the folks who came out to speak tonight. We have heard and truly heart-wrenching testimony. Thank you for sharing your stories in public space so we can all learn and grow from what you shared. And I also just want to thank all of you who care about Rivian, care about other people, and want to make the city the best place possible. And as a new alder, I found it inspiring to be in a room with people who care so much about the city and care so much about.
Thank you, Alder. Any other comments from colleagues? Seeing none, I'll just quickly wrap up. I mean, I'm in favor of reading filings. I know, just to reiterate again, definitely thank everyone who came out to testify on this broader issue, not just on this, but surround safety of potential. Already mentioned this work the mayor administration through hearing with colleagues, others on the board, city staff, nonprofit, whoever. We'd all work together really to make sure that the public is aware of it and really communicate as much as possible. I agree. I think in general it's always difficult to communicate things, not just about this, but about really anything in city government, and it's always something that board and nonprofit leaders, community members try to get better at. It's really a collaborative effort, and yeah, I really, really appreciate everyone who came out to testify and all the work that they're doing in communities. She obviously affects all those even elsewhere. And so I'm glad that we could come here today to be it and continue this conversation around justice. Having said that, is there any discussion, comments from colleagues? Seeing none, all those in favor to read it file say aye. Any opposed? Any abstentions? The motion passes to read and file this item.
Mr. Chair, move that we adjourn.
Motion has been moved. Any discussion? Seeing none, all in favor say aye. Any abstentions? Any opposed? This meeting is now adjourned.